You. It's a great honor to be here in the auditorium, beautiful auditorium of AIIMS Bathinda, and I thank you, Dr. Vitull and the organizers, and also congratulate you for organizing such a huge program. I think that really, is a commendable work which you have done. So, my duties was to tell about the new topic. I think most of the people in the audience, I don't know whether you know. Uh, First, I will just a small introduction about myself. That I am graduate from Government Medical College Patiala, and then I did my PhD from Jawaharlal Nehru University in Public Health, and currently I am working as a scientist with the Indian Council of Medical Research. In the audience, have anybody heard about the term assistive technology? Anybody? Can you raise hands? People, those who know me, doesn't have to raise their hand. Anybody from the student side? Have you heard the term? Anybody using spectacles? Are you using? So, spectacle is one form of assistive technology. Okay. Anybody using hearing aid? Wheelchair? Stick? Walker? Mobile phones? All of you are using. And so, when we talk about assistive technology, we start with the functionality and disability, controversy. In India, I don't know, one part is missing. So, there are two, issues in India. One is disability, other is the functionality. So, I'll not go into detail, but disability is a larger topic and it has more so of a social relevance. And in the disability, the health component goes to the health department, which we have totally neglected till now. So, the responsibility of health is to deal with the functionality, morbidity and mortality. So, functionality is the ability of human body to perform certain functions, and morbidity we all know that basically what we are learning here and treating the patients, and mortality is the end of the life. So, our efforts remain focused on these three areas: how to prevent mortality, how to treat morbidity, and how to restore the functions. But we never think of all these things what we do. So, most of the chronic health conditions interfere with functionality and restrict or impair our functions. Whenever somebody falls sick, they either are given bed rest or they are supposed to not to take certain physical activities which we normally do. So, it could be physical, physiological or sensory. So, the functionality could be affected due to our physical functions or physical structures and physiological functions and sensory functions. So, that is what we talk about the assistive technology. Assistive technology is generally a broad term which includes the assistive products or devices or aids or appliances or instruments or softwares which are used for maybe locomotor, visual, hearing, cognition, communication, self-care or sports, recreation, leisure activities. So, anybody who has these kind of conditions which are listed here, they are having some difficulty with the functionality. So, people with chronic diseases, burn injury trauma, older persons. So, why we say that this discussion among competition between functionality and disability is because when we say disability, and it affects functions, but on the other side, the same kind of function may also be affected in the older person, but we don't say that they are disabled now. So that part is mostly the responsibility of health. So we have to own it, and that is what my role is right now within the overall function of Indian Council of Medical Research. So then children with autism spectrum disorder, neurodevelopment disorders, or learning disorders, and then mental illnesses or mental health problems, post-infection situation like leprosy or polio, there are certain functions which are affected or restricted. Then people with gradual cognitive decline, and also the people with disability as per the RPWD Act. So all these conditions, they can be very well managed with help of the assistive technologies. Now the government gazette, this is 2020 gazette, which says any of such product should be considered as drug. So that means they are medicine now. So right, that's why we are talking here, because any spectacle, hearing aid, wheelchair, walker, they are now the part of health and are considered to be as a medicine, among the medicines. So here we talk about the healthcare continuum. We deal with prevention, we deal with the promotion, we deal with curing managing the conditions, or rehabilitation, and assistive care or assistive technology, and palliative care. This was earlier, you might have heard or read about 5 part of the healthcare continuum, but now WHO says that it has to have 6 components. One of them is assistive care and assistive technologies. So assistive technology refers to product and related systems and services developed for people to maintain or improve functioning and thereby promote well-being. It enables people with difficulties in functioning to live healthy, productive, independent, and dignified lives, and participating in education, labor market, and social lives. So now again, this diagram or this flow chart on the right side talks about the health product. Again, this is a new thing which is under consideration now, WHO. All the product or instrument or equipment used in the healthcare settings are now termed as health products, which could be drugs and medicines, which could be diagnostic, assistive technology, medical devices, which could be vaccines, blood cell gene therapies, or digital technology like softwares and apps. So these 7, out of the 7 category, assistive product deal with 7 domains, as I already said: locomotor, visual, hearing, cognition, communication, self-care, sports, recreation, and leisure activity. But somewhere I read there are other classification also as per ISO 9999, which is the basically setting the standards of various products. So ISO 9999 talks about 12 categories, and ICF classification, International Classification of Functioning, Disability and Health, they talk about 12 categories. I think 16 categories. So this is the new classification which will be adopted by WHO. It's under consideration and under debate, and we are discussing it, and already lot of discussion has happened, and very shortly there will be a document in the public domain for the comments also. So the domains covered as already shared. Now these are the common assistive technologies. This has been like now common is walking sticks, eyeglasses, white cane, torch, wheelchair, anti-bed sore mattresses, auxiliary crutches or elbow crutches, bed protecting mats. So there are n number of assistive products which are available, which we are now trying to position within the healthcare settings. So then there are specific products for children, because among the functions which children are performing or older persons are performing are totally different, because children has to go to school and learn new things. So the cognitive products or communication products are more important for them. Then what are the role of assistive product in the chronic medical conditions? So if we say they help in the prevention, the assistive technology help in preventing the worsening of chronic condition and secondary complications. They are also monitoring devices like wearables and small devices like blood glucose monitors, heart rate trackers, blood pressure monitors. They all help us in preventing the disease progression by alerting users and healthcare provider about irregularities. Now this watch, they have so many functions. You can do ECG, you can monitor your heart rate, you can monitor your blood glucose levels also. So many advancements have come. So this is, wearables are one of the very important assistive products now in our lives. So there are mobility aids like orthotics, shoes, walkers. Now for diabetic, the orthotics or therapeutic footwear is very important, which is another big area which we are developing now. None of the standards are available for therapeutic footwear globally. So we are trying to define those standards for our populations, especially for diabetic, because foot care is very important for them. And then there are other similar requirement for children with footwear, club foot, or maybe cerebral palsy, and so many other conditions like that. Ergonomic solutions also, they also help us in our back pain, like good beds or chairs or tables in our office spaces. Then management of chronic medical conditions also, the assistive product help us in managing. So like adaptive utensils and reachers and bathroom aids, they help us in the management of various chronic medical conditions. Medication managements, the automated pill organizer, dispensers and apps, they send you the reminders. And also the sensory assistive devices for individual with hearing loss or visual impairment or cognitive issues. So there are screen readers also. And then now there are a lot of advancements in the software industry or software area, which help us immensely. And we can also take help for our patients, because so many patients, they forget to take the medicines. So reminder and alarms and wearables are very helpful devices. And then rehabilitation, exoskeleton and robotics, there are advanced level of devices available now which help our patient during the rehabilitation phase. The prosthetic and orthotics, custom designed limbs, braces or splints, and cognitive rehabilitation tools like devices and apps that improve cognitive function, such as memory aids or brain training apps, or like brain computer interfaces. There are now artificial limbs which works which can be controlled with my brain, with the patient's brain. So also the assistive care help us in maintaining the quality of life through telehealth and remote monitoring. Lot of telehealth systems are there, beautiful telehealth systems are there, which can you plug in the different things. You can do the blood test, you can do ECG, EEG, so many things you can do through those kind of machines. Then communication aids. So those people which are not able to communicate with others, there are certain sensors which detect their emotions and convert it into text or audio or videos. And then environmental control, again one of the very important area now which we are working on is the home automation, because our elderly, they are alone at the homes and nobody there to take care of them. So there are certain home automation systems which can be used to give them a good dignified lives. So this is the exercise which we did in ICMR on the pattern of WHO. This is called National List of Essential Assistive Products. WHO had in 2016 proposed a list of 50 products called APL list, Priority Assistive Product List, which they wanted, because we are the part of WHO and UN. So whatever is proposed by WHO, it is almost mandatory on the countries to adopt it. So we did that exercise. It was a huge exercise, and we have come out with these 21 products which are now in the public domain. You can download this PDF file from ICMR website, National List of Essential Necessity Product, and this list includes hearing aids, and then aids for the visual impairment, walkers, wheelchairs, then braces, artificial limbs, therapeutic footwear, ramps, and then various type of mobility aids, mobile phone. Mobile phone are again two types. One is those which can be used by the older persons, where the font size or the only buttons are there, and very few commands can be done through that kind of mobile, or advanced level smart mobile phones. And also the incontinence products, which are used by mostly the patient who are bedridden in the hospital environment or at home care, or the home settings. Then there are certain fall detectors. So this list is basically indicative list, and it is like that now it's in essential list. So you might have seen during the COVID time, bread and milk used to be the essential item. Similarly, this list also has become mandatory for the governments to take it up, and slowly we are building around the systems for the availability of this product even in the remote and rural areas. So I'll stop it here, because there are many other slides which I had made, but they are mostly related to the cognition and communication area. So any questions, you are most welcome. Thank you very much.
Thank you, sir, for a very informative talk, especially in assisted device, what ICMR is doing. I think most of the people are unaware. So until and unless they visit the site of ICMR, only then we will be aware that what ICMR is doing for control, prevention, as well as in the area of assisted devices. Thank you very much, and we are really honored to have you here.
So I would request the audience to, if they can visit the National Center for Assistive Health Technology, NCAT, download this list, and you can visit the NCAT center at AIIMS and IIT Delhi and IIT Madras and NISH Trivandrum. So you will have the actually, real feeling what we are doing as far as innovation is concerned. Thank you.
Thank you, sir. Thank you very much. Before we start our next lecture,